psychosocial stresses can cause real pain or illness, but effective treatment is available.
Welcome to the Secrets of Being podcast. I'm Dr. Dawn Earhart Whitty, your guide on a transformative journey of personal development and discussions of universal truths. Join me and a panel of life coaches and spiritual leaders from around the world discussing how to handle some of life's greatest challenges. We will be sharing stories of love, faith, and inspiration with you, our faithful listeners, to live your happiest and most fulfilling life, full of purpose and passion for yourself, your families, and the world. We are here to be the change we wish to see. Let the conversation begin. Hello and welcome to the Secrets of Being podcast. Today, I am so honored and thrilled to have Dr. David Clarke with us today. He is a physician and he is the president of the Association for the Treatment of Neuroplastic Symptoms. And I can't wait to talk about that because I had never heard of it before myself. He is a host of the Story Behind the Symptoms podcast and author of They Can't Find Anything Wrong. And I think this topic is so important. I cannot wait to delve into it. Please take notes, because it's going to be a powerful conversation. David, Dr. Clarke, welcome.
Thank you very much. And I should mention that we're recording this on Halloween, and that's why I'm wearing a bright pumpkin sweater.
Well, happy Halloween to you.
Yes.
Dr. Clarke, would you like to tell us a little bit more about how long did you practice medicine before you started seeing things that more of the mind-body connection that you now are so passionate about?
Yeah, it's almost embarrassing to admit as a physician that I went through 7 years of formal training without having a clue about any of this work that I do now, that the brain could actually cause pain and illness in the body, like every other standard Western trained physician. I got a very good education, University of Connecticut, and then Harbor UCLA Medical Center in Los Angeles, and we were taught that if you have pain or illness, you must have a structural damage or an organ disease to explain it. And I was doing very well in that world. I got an award for excellence in medical school. The residency program I matched into was top notch. I was delighted to be there. But then in the 8th year of my formal training, I encountered a patient that I didn't know the first thing about diagnosing or treating, which, came as rather a shock because by the time you get to the 8th year, you've really learned a lot. I mean, you've got your license, you can go out and practice. I was taking some extra training to become a gastroenterologist. But this patient, she'd already been evaluated at another university, and they could find no reason why she was having this severe gastrointestinal condition. I can share with you that she was averaging one bowel movement per month, despite taking 4 different laxatives at double the recommended doses. So we had some specialized testing that we did, and my department chair and I were convinced that this test was going to show what was wrong with her, because as far as we were concerned, nothing else was possible. But that test proved to be normal as well, and we were left completely baffled. I was doing her exit interview, essentially telling her she was going to have to live with this. But we got into a little more involved discussion, and at some point, she trusted me enough to share with me that she had been severely abused as a girl, sexually molested by her father on countless occasions. But that had stopped 25 years in the past. She was 37 years old. And I had no training, and again, this is embarrassing to admit, no training on how to take a history from somebody like that, no training that it could possibly be related 25 years later to somebody becoming truly physically ill in a severe way. But I just fell back on the basics, and I got the story from her. And again, she trusted me enough to share this. Her husband was the only other person who knew. And I didn't know what to do with that information. I really wasn't at all convinced that it could possibly be related to her condition. But there was a psychiatrist at UCLA that I knew was interested in these mind to body connections. So I thought, I'll send the patient to Harriet Kaplan, the psychiatrist, and maybe she can learn to live with her condition a little more successfully. Okay, so I forgot all about her after that. 3 months go by, and I ran into Harriet in the elevator ride that changed my career because between the ground floor and the fifth floor, she told me she had cured this patient with less than 3 months of weekly counseling sessions, which absolutely astonished me that you could alleviate a real physical condition just by talking to somebody. I'd never heard that. And again, embarrassing to admit, but patients with these kinds of problems, real pain or illness, not imaginary, not in your head, real, that are generated not by organ disease or structural damage, but by the brain. It's 20% of the adult population, at least. It's 40% of people that come to visit a doctor. I didn't know that at the time. I thought this was a rare phenomenon, but I wanted to be a complete doctor, so I had Harriet teach me her basic framework for how to think about this. And when I got into private practice a year and a half later, um, I started using it and started finding that there were a lot of people with these problems. That I would do my due diligence to find organ diseases or structural damage. And if I didn't find anything, I would use Harriet's framework. And I was finding 5 or 6 patients a week with these problems. Not as severe as the first one most of the time, but um, definitely uh, I could uncover stress, trauma, emotions, life challenges, the long term impact of childhood stress, sometimes severe, like the first patient, sometimes much more subtle. Things like not getting enough support or getting too much pressure put on you as a kid. Anything you wouldn't want to have happen to a child of your own, for example. And I was having success. People were getting better in response to this approach, and it was tremendously rewarding personally and professionally. So it's kind of a long-winded answer to your question, but now I'm 40 years later from the time that I first started doing this, 7,000 plus patients that I've successfully diagnosed and treated. And I started, I wrote a book and started giving presentations all over North America and Europe, and now I'm the president of the largest nonprofit in the field.
That's an amazing story. So do you incorporate this in your when patients come to see you, incorporate that initially, or do you first go in and look for the medical stuff and then go into maybe something deeper than just the symptoms?
Yeah, it's a good question. What I teach my medical audiences is to bring this up right on the first visit, even before you've checked somebody for organ disease or structural abnormality. At least mention it, get people thinking about it. So that, when I'm seeing somebody, let's say with upper abdominal pain, I might be talking to them about gallstones or inflammation of the pancreas or an ulcer. But I'm also mentioning that stress could be responsible because the symptoms can be every bit as severe as those caused by any other form of illness. So I want people to be thinking about whether there could be a stress going on in the present day or perhaps in the past that's persisted until the present day. And then I'm ordering the necessary tests to make sure that there's not a physical problem going on. But then if those tests are normal, we're ahead of the game. We've already been having somebody think about stresses. And sometimes when I bring it up, they give me information that clinches the diagnosis on the spot. A very simple example of that is a man who and he'd been going to other doctors for months, but nobody found out until I asked him that he was only getting his stomach pain when he was driving to work. When he was driving home from work, he was fine. Same on the weekends. Not at work on the weekends. Felt perfectly fine. And that you can't get that from an ulcer. An ulcer doesn't know if you're at work or not, if you're driving home from work or driving to work. And of course, he had a huge stress in his workplace, and the duration of the stress corresponded exactly to the duration of his symptoms.
I that's powerful. I mean, I know that when we're stressed, sometimes we can feel it in our neck and our shoulders. We can feel so if it does that to our muscles, it must also be doing things to our organs and our chemicals.
Oh yeah, it can do it from head to toe. Migraines, dizziness, ringing in the ears, temporomandibular joint problems, visual disturbances, difficulty swallowing, pain anywhere in the spine is mostly neuroplastic. That's the term for this, that it's the neuro part comes from brain and nervous system, and the plastic part is jargon for a capacity for change. So it can change into the nerve pathways can change in a way that produces illness, but it's very hopeful because they can also change back to a healthy pattern. So other conditions, chest pain, abdominal pain, pelvic pain, bladder spasms, irritable bowel syndrome, fibromyalgia, functional neurologic diseases, many cases of long COVID, many cases of chronic fatigue, certain kinds of rashes, joint pains. The only common denominator that we found is that people with neuroplastic symptoms tend to have more than one symptom at a time, an average of about three of them simultaneously, we found in a recent national survey.
Wow. Well, another thing that had come with some of your information is, I wrote it down. 1 in 6 adults suffer from chronic pain or illness that is either medically unexplained or unresponsive to virtually any treatment. And I thought that statistic that's crazy. But
Yeah,
here's my
but it's
question.
true, and it's actually even the recent surveys have shown that it's probably even more than that.
Mm. So, which came first, the chicken or the egg?
You mean the stress or the symptom?
Uh-huh.
Oh, the stress comes first. When you are experiencing a stress, a trauma, emotions, long-term impacts of adversity in childhood, and if they have been repressed in a way that they're not fully coming into conscious awareness, because most of my patients are not fully aware of the magnitude of what they're coping with. They know they've got some stresses. We all have that, but they don't realize how much they have. So they're consequently not able to fully deal with it. And so the mind is essentially unloading it into the body. As you pointed out before, people can get neck and muscle tension when they're under stress. People can get headaches from that. Another brain to body phenomenon, very simple, blushing with embarrassment. That's brain to body. Feeling a knot in your abdomen when you're in a tense situation. Most people have experienced that. That's a brain to body. So it's the stress is the first thing, and then the nerve pathways are changed in response to that, and then you get um, abnormal processing of normal signals that are coming up from the body, and you also get signals coming from the mind into the body and causing problems in that direction. So the key is to uncover what the stress is, what has been going on in your life today, what perhaps did you go through as a kid that, like I say, you wouldn't want a child of your own to go through, and maybe that's impacted you more than you realize. A lot of my patients will say, "Oh no, my childhood it wasn't that bad. My parents cared about me. There weren't any issues going on that I really had to worry about." But when I ask them, imagine your own daughter or your own son going through exactly what you did, and you have to watch them go through that. Would you see anything that would make you sad or angry to observe that happening to your own child? And for a lot of people, that gives them a new insight into what they went through that is more accurate than what they used to believe.
Well, and then that leads me to the question that I was going to ask next. I heard you speak about ACE. Can you explain what that is and how that impacts all of this?
Yeah, adverse childhood experiences is what that stands for, and that's a standard terminology in the field. And it refers, again, to anything bad that can happen to a child. The common denominator is, in my practice, is people who were made to feel like second-rate human beings as kids in any of a variety of ways, or sometimes worse than that. Not just that they're not measuring up or they're second rate, but they can sometimes be made to feel worthless, or they can be, put under so much pressure to perform, and that they never, you know, get to reach the standards that the parents are setting for them, and they just feel like they're failures. Another patient of mine tried to deal with with her father's alcoholism by hiding his liquor bottles, starting when she was age 8. And he would always find them. So, and when he drank, he got, angry most of the time. He'd lose his temper. So she really felt like a complete failure that as an 8-year old, she wasn't successfully dealing with her father's alcoholism. And she carried that sense of not being good enough well into her adult years. And that leads to lots of other things, personality traits where kids try to be as perfect as they can be. They try to please everybody. They try to focus on solving everybody else's problems. They don't put themselves on the list of people that they care for. They don't assert themselves very well. They don't set boundaries with toxic people. They often don't even learn how to play. So you talk to them about what they do in an average week, and you don't hear much about people doing things for their own joy. They often have pretty powerful emotions that they're not in touch with. They can be really angry or afraid or have shame, grief, or guilt, and they don't fully recognize that those things are going on. They are a bit like dormant volcanoes on the outside with boiling magma on the inside. And that, if those emotions can't get put into words, they get expressed via the body instead in the form of physical symptoms. I've seen that just over and over and over again. And then finally, the last of the major impacts of the ACEs are triggers, which are people, events, or situations in your life today that are having an outsized emotional impact on you because they are reminding you of something that happened in the past. And the most obvious example of that is an adult who mistreated you as a kid who is still in your life today. And if you didn't learn how to set boundaries with that person as a kid, which few people do when they're children, you may very well not know how to set boundaries with that person as an adult, and so they can still impact you. The very first patient I described in the book you mentioned, they can't find anything wrong, had been hospitalized at a major university 60 times in 15 years, and they had no idea what was wrong with her. She was having severe attacks of dizziness to the point of vomiting, and these would go on sometimes for 3 or 4 days. And it was all connected directly or indirectly to interactions with her abusive mother, who had been abusing her since she was 3 or 4 years old, mostly verbally and emotionally, and was still doing it. The woman, when I met her, was 50 years old, 50, and was still suffering at the hands of her own mother, who the mother was in her 70s at that point. But by showing her that connection, by showing her that, her own mother was triggering these attacks, once she saw that, I can still remember she looked up at the ceiling and said, "Oh my God, I can't believe it." And in her case, she was cured on the spot. Once she saw it, she could set the boundaries, and she never had any more episodes.
That is amazing. So she didn't even have to go through any kind of counseling or therapy. Once she had the aha moment, that was
Yeah,
game over.
yeah, I wish I could cure everybody that quickly. I mean, I did suggest to her that she might want to seek some counseling. I honestly don't know if she ever did. She lived in California and I was in Oregon, but she called me a year later, said she'd gone the whole year with no episodes. And previously she had had between 6 and 10 episodes in 12 months. So that was clearly a major turnaround for her. But yeah, other people, they absolutely need psychotherapy. We've got well documented research now from centers across North America that show tremendous benefits from a new form of treatment called neuroplastic recovery therapies. There are several subtypes, but they're all closely related. The most well known of the studies was done in Boulder, Colorado. And they took people who had had chronic back pain for a decade on average, and in 4 weeks, they dropped that back pain scores by 75%. Just by talking to people. And they compared it with two groups, one who got their usual treatment and the other got a big injection into the spine. Those groups barely budged in terms of their pain. So the separation from the people who got the new kind of talk therapy was just extraordinary. It got national publicity.
So they didn't have the traditional procedures. They just had the talk therapy. Is that
That's
correct?
right. That's right.
Wow. And you said 75%?
75%. It went from an average pain score of 4 out of 10 down to 1. And that's after 4 weeks. They followed them out for 11 months after that, and the pain scores stayed down. And now they followed them up for 5 years, and the pain scores crept up a little bit, but they're still way down from where they were when they started. And that's just, to get 5 years of response from a 4 week treatment. It was just 2 hours a week for 4 weeks. That's all they got, and it was enough. Just extraordinary.
And one of the things I heard you say is less than about 1% of doctors incorporate this kind of treatment in their practices. So,
That's the mission of my nonprofit, is to change that.
yes. And so, how are you doing that? Because I think it's amazing what you're doing.
Yeah, at the website symptomatic.me, we've got all kinds of resources, both for the public and for professionals. We have courses, but we make them jargon free so that the public can take them as well. And medical professionals and mental health professionals. They've all got different jargon, so we just took all the jargon out. We have written 2 textbooks, multi-author. We have monthly international webinars that we do where we have experts answering people's questions, one for the professionals and a second one for everybody, including the public. We have an annual conference. We just had that in late September of 2025. 350 people came from 4 continents. We're having this every year. The next one is October 15th to 17th, 2026, in Dallas, Texas. And we had 40 speakers there who are all experts in different aspects of this, different parts of the body where these symptoms can crop up. So lots and lots of resources for people. The podcast you mentioned that I do, the story behind the symptoms. I interview patients much as I used to do in my office and uncover the roots of where their illness is coming from. And I have 2 colleagues who are physicians who do a parallel podcast that's complementary to mine, called The Science Behind the Symptoms, where they talk about neuroscience and the research studies around the new forms of treatment. So lots and lots of resources for both professionals and the public. And when the doctors learn how to do this, they absolutely love it. I mean, imagine uh, in any profession, if 40% of the problems that came across your desk, you had no training in how to solve, you would get burned out pretty quickly. And these patients contribute to burnout, especially of primary care doctors. But once they learn how to diagnose and treat this condition successfully, it's very rewarding to see people, some of whom have been ill for decades, and they turn it around. They can have complete alleviation of their symptoms. And that's why most of us, went into this business, is to see people get better. And I had a family doctor who learned from one of our courses, took me aside at a conference and said these ideas had put the joy back into her work.
I never really looked at it from the physician's standpoint, but I have somebody who's very, very close to me in my life who has, for I don't know, 20, 30 years, in and out of doctors, in and out of procedures, treatments, surgeries, all these things, and they still can't find out what's going on. And it's so frustrating for her. So, what does someone like that do when they can't find a Dr. Clarke or the 1% of doctors that have been trained like
Yeah,
this?
well, once you walk into a doctor's office with a new symptom, you've already got a 40% chance of having a neuroplastic condition. And once you've had all the diagnostic tests and they haven't found anything to explain your condition, or they think they found something and they treat it and it doesn't make you get better in the way the doctor expects, then you're probability of having a neuroplastic condition just goes way up, over 90%. And that's clearly the next thing that should be evaluated. We have a 12-question self-assessment quiz on symptomatic.me. Takes less than 3 minutes. The more questions to which you answer yes, the more likely it is that you have a neuroplastic symptom. And then from there, try the resources that we have available and see if you make progress. Everything on that website has been evaluated scientifically or by clinical experience of doctors who've got, been doing this for decades. And when people start to use these resources and they start to notice that they're getting better, that is very solid evidence that you're on the right track.
Well, I don't know exactly the procedure you go through to do this, but I did. It was a childhood regression thing. I was doing a personal development workshop, and we had done this like thing where we went back into our childhood and whatever. And I remember after this thing that we did, the next day I woke up and I felt like I had the flu. And I knew wasn't sick because I hadn't been out of my house for days because I've been on this thing. And I looked it up and I kept thinking I'm having a somatic release. And do you have like experience where it comes out where it feels like it's something else, but then it's like just toxins being released from your body and your nervous system? Is
Yeah, it can absolutely feel like that. Some people, when we start talking to them about these issues that maybe they have repressed for a long time and we bring them up to the surface, they can get temporarily worse. But it basically means that your mind is now at a place where it can successfully deal with these things. And confronting them for the first time can be upsetting. Having those feelings suddenly appear in your conscious awareness when they've been repressed for years or even decades can be difficult, but it's the first step in overcoming them is to become consciously aware of them and then be able to put them into words. Many of my patients, for example, I have had them write a letter to the person or persons who mistreated them as kids, not to mail it, just to write it. And by putting those thoughts and feelings into words, the good things about the person as well as the bad, um, they're expressing that onto the page or onto the computer screen, and it doesn't need to be expressed via their bodies as much anymore.
that's very good advice. Um, what are the odds or the chances that this gets incorporated into traditional medical schools?
Oh, it already is.
Oh, good.
Once the research came out, and I was able to point to, again, studies from Halifax, Harvard, Detroit, the one I mentioned in Boulder, another one at UCLA. I mean, these are very persuasive studies. They're published in prestigious journals. They're very carefully done to, gold standard science. And when I showed my local medical school these results, they invited me to start teaching there. And even earlier than that, a decade ago, the dean of the medical school in Slovenia, of all places, came to hear me speak at a conference in Spain, and he said, "This is great." And he took it back to his medical school, and that was, to my knowledge, the first medical school in the world that incorporated this into their teaching. And they had me out to their capital city to speak to their National Congress of Family Doctors a few years after that. It was a great experience.
Well, I mean, again, thank you for bringing this to traditional medicine because it's that piece I think that's been lacking.
Yeah, I mean, it's like I say, 40% of people that come to a primary care physician, and to get through the first 7 years of my training without having any clue about this, I mean, that was, quite a number of decades ago, but it's still the case in most formal medical training today. But we're finally starting to see it show up. The research has been very persuasive, and there's more in the pipeline that's going to get published in the next couple of years. And I think, even the most skeptical medical clinician is not going to be able to ignore this evidence anymore. It's challenging because it's a completely different way of thinking about illness and disease and pain. And you have to start talking to people about psychological issues where in the past, physicians have traditionally talked about organs and structures. But if we can collaborate with our mental health professional colleagues, um, we're going to get night and day differences in the outcomes for patients. It's a problem on the mental health professional side as well, because typically they're not taught to how to evaluate somebody who's got a physical symptom as opposed to a mental health condition. But if we can just bring these two sides of the mental health, I'm sorry, the health professions together, get them to collaborate with each other, um, we're going to completely turn around the care of this group of patients.
Yeah. I mean, if we only understood how powerful our minds are, we could start believing. I mean, and one of the things that I think is as somebody's going through all these years of the physical pain, but then in and out of doctor's offices, in and out of procedures, um, being afraid, oh my God, do I have cancer? Do I have that? That takes a mental toll in addition to whatever it was you were repressing or, that happened in your past. That's got to add to the severity of whatever you're experiencing, right?
Oh, the fear is one of the worst aspects of this. Do I have something serious? Am I going to be disabled for the rest of my life? Am I going crazy because I have this symptom that feels real to me, but the doctors can't find a reason for it? It's a terrible mental burden that only adds to the severity of the symptoms. And the level of severity can be astounding. I mean, I've had patients in the hospital with this. One of my patients suffered abdominal pain that was unexplained from age 8 until age 87 when she finally got to my office and we had a conversation. Another patient had a completely paralyzed stomach, not the belly, but the actual organ, of digestion, the stomach, completely paralyzed, was not contracting at all, purely from brain to body phenomenon. Another patient I was asked to see on her 70th day in the hospital, a 17-year-old girl who was experiencing abdominal pain that 6 other specialists had not found a cause for. She was getting massive doses of morphine around the clock to try to control the pain. It was 100% stress related because when we uncovered the stress and we started working with it successfully, she turned her own morphine dose down. She left the hospital in a week on on opioid tablets, and she started weaning herself off of those. And 30 days after we met, no more medication.
Wow. Wow. I mean, you're a hero. You really, truly are. And I love that you are truly healing people and helping others to help people heal.
It's very rewarding work, and I know when my professional colleagues learn how to do this, as I said before, they absolutely love it. You don't even have to um, get too deep into the complexity of all this. If you can just talk to people about what stresses are happening in your life right now, um, did you go through anything as a kid that you wouldn't want your own child to experience? And if you start uncovering those kinds of issues, then to have a mental health professional that you collaborate with, who feels comfortable talking to somebody who's got a physical symptom, it's not that big a stretch for any healthcare professional. And the change in outcomes for the patients is just night and day.
That's wonderful. That's amazing. And I know that's going to give so many people hope, including this person is in my life that I love very, very much. And it breaks my heart to hear all of the things that she's got. I mean, I can't even imagine just being in and out of doctors' offices, being in pain, and then having them say, we can't find what's wrong with you. Well, let's try this. Let's try this biopsy. Let's try that. And that, I mean, just the hours, the money, the time, all of that that goes into that. And then the worry in addition to the pain, you're giving people hope. And I think having hope is one of the best things anybody can have.
Yeah. Now I should emphasize this approach doesn't work if you've got, an inflamed pancreas or,
Mhm, mhm.
a bone infection. It applies to people who don't have an organ disease or structural damage, but that's a very large number of people. We just did a national survey where we asked people, do you have pain or illness? Does it have a good explanation? If it does have a good explanation, is it getting better in response to treatment in the way your doctor expects? And we had 24% this was a nationally representative sample, 24% of the population said, yes, I've got pain or illness, but there's no explanation for it. And another 24% said, there, I have been given an explanation, but I'm not getting better the way the doctor expects me to. A lot of those people probably have a neuroplastic condition as well. So, we're looking at, possibly 100 million Americans that are suffering from this that don't have to be.
Yeah. Yeah. Well, again, thank you for the work that you're doing, bringing this. I mean, again, I've been studying mental health and personal development for years, never heard of neuroplastic before. So this is another rabbit hole I'm going to go down because I want to learn more about it. But we're going to include all of this in the show notes so people can click on it and find you because what your work is so important. But can you tell people where they can find you and also leave us with a golden nugget that you just really feel is very important for people to be left with?
Yeah, well, you can find us at symptomatic.me. That's the website of the Association for the Treatment of Neuroplastic Symptoms, which is a nonprofit. It's founded and led by volunteer physicians and mental health professionals. And I personally donate all the money that I make from this work to the nonprofit, including book royalties, speaking fees, and on and on. As far as the golden nugget, I think we can boil it all down to the fact that um, psychosocial stresses can cause real pain or illness, but effective treatment is available.
Oh, thank you, Dr. Clarke. You are a gift.
Thank you.
All right. Well, thank you so much for joining us on The Secrets of Being, and we will see you next time. Thank you for tuning in to the Secrets of Being podcast. We appreciate your time and support. If you enjoyed this episode, please like, share, and subscribe to stay updated with more inspiring content. For further inspiration, visit thesecretsofbeing.com and join our community. Until next time, stay inspired and keep unlocking the secrets of being.